Hi everyone, welcome to another episode of Simply Healed. And I want to wish everybody a Happy New Year. It's 2022. And we don't want to start the new year this way, but we have good news, right?
Yeah.
So this is our monthly COVID update and the first update of 2022. So I'd like to welcome our regular speaker, Dr. Jansen.
Hello everyone, hello Shan. Happy New Year to you all.
We're so glad today's topic is going to be on the Omicron. Yes, it's not pronounced Omicron, it's pronounced Omicron variant of the COVID-19. So Doc, you have good news for us?
Yeah, absolutely. So as of December 15, the Omicron virus was officially
Entered Philippines.
entered Philippines, no? So, but as you all know, the transmissibility of the Omicron is higher than the Delta. By how much? It's the likelihood that you get Omicron versus Delta is at least 3 times.
Wow, three times.
3 times. So it's in terms of transmissibility inside households, it's more transmissible than the Delta variant. Okay, but when it comes to disease severity, that's where the good news comes in. Okay, so before we go into the disease severity, take a look at this graph. Okay, so we have R here. So as you all know, R is the replicative, the potential to replicate. So what we see here is 3.7. Okay, so this means that, yeah, it is compared to the Delta variant, it is at least 3 times more likelihood to spread. And
wow.
Its growth rate is 0.35 per day. Okay, these are just the initial findings. So these numbers can still change in the coming weeks, in the coming months. So all of us would have to hold our breaths. But initially, right now, what we know is that it is more transmissible than the Delta variant. Okay? So here's the good news. In terms of disease severity, we see a lot of mild cases.
Wow, that's great.
Yeah, definitely.
So actually that's also good for our immune system, right? It means more people will catch COVID-19, but they will catch a weaker.
It's
almost like a vaccine, but this time it's the full-fledged virus itself. Wow.
Okay. So here, what we see here, the immune escape, no, it's incomplete. Meaning the neutralizing antibodies that we got from the vaccines, that we got from the natural immunity. So if you were infected previously with COVID-19, the protection that you have from those two will still be very good in combating the Omicron variant. Okay? So the next thing is, so we know that there are a lot of different parts of the immune system. And one part of that is the T-cell immunity. Now, the T-cell immunity in combating Omicron is preserved. So what does this mean?
Yeah, what does that mean?
So very few people will actually get hospitalized from Omicron.
That's good news.
Yeah. Right, that is really, really good news. So this conclusion from the studies, this one was actually concluded based on those who are vaccinated and who got natural infection, or those who actually got COVID-19 previously. Okay. Yeah.
So Doc, it's really interesting, right? That when we started the pandemic, everybody wanted to avoid getting infected.
Yeah.
So in fact, as time goes by, if you were actually infected with COVID-19 prior or vaccinated, you are more protected now than before.
Definitely.
So I think this is a positive note. I think we should we wanted to encourage everybody not to be so fearful. We respect COVID-19. We take all the measures from vaccination to mask to social distancing.
Yeah.
But if you do become COVID-19 positive, and especially if you're asymptomatic or mild, it's actually good news.
Yeah, it's actually good news.
It's actually good news. It means that after that you are very protected.
Yeah. So this would be similar to getting the
chickenpox.
The chickenpox, the common colds. Yeah, it would be really mild. Okay, so don't be afraid of Omicron. Okay. Now, if you're wondering, how about detection? Yeah, the technologies that we have right now, the RT-PCR antigen testing, both of them will work perfectly in detecting Omicron. Okay.
So the same test kits we've been using is
same.
going to be effective. So you can use that to diagnose yourself and protect your family.
Okay, so next is vaccine
Vaccines.
efficacy.
Okay.
Now, so that is this is also I think a lot of
Yeah, we're all
viewers
wondering.
here, yeah, all wondering.
Is our vaccine gonna
is
work?
our vaccines gonna work for Omicron? Okay, now vaccine effectiveness in terms of preventing hospitalization can decrease. Okay, but it will still be enough protection. Now, here's to give you a perspective. Okay, Pfizer protects you from getting hospitalized almost 100%, right?
Wow, okay.
Yeah, almost 100%. Now, that is for the Delta, the Beta variant, and the Alpha variant. Now, for the Omicron, take a look at this graph. If you have 2 doses of Pfizer vaccine, no, just 2 doses of the primary dose series, then your protection from getting hospitalized with Omicron is around 40%. Okay, so that is how effective Pfizer is.
That is really still significant protection.
Yeah, though of course, if you compare it to having being protected from the Delta, from the Beta variant, from the Alpha variant, it's almost 90+%. Yeah, with Omicron, 40% is still significant, so you still get protection. Okay, now how do you get? How can you increase your protection? You get the booster. Now take a look again at both of these graphs. Okay. So here on the first diagram, the first graph, right on the left, okay. So this is for those of you who have AstraZeneca for your primary dose series. Okay, if you take a booster dose of Pfizer or an mRNA vaccine for that matter, no?
Yeah.
Okay, you increase your vaccine effectiveness to around 70%, which is really huge. Okay. Now, if you underwent Pfizer as your primary dose series, then you increase your vaccine effectiveness to about 80%.
Wow,
which is still
from
significant.
40% to 80% if you take the booster
Yeah.
shot.
So it's still very, very significant. So all of our vaccines work, okay? Vaccines work. So it's just that the booster that you have to take should be an mRNA vaccine so that we can see a very significant increase in the neutralizing antibodies against Omicron.
So that's the data coming from the pharmaceutical industry.
Yeah.
Right. All right, that's great. Great news for all of us who are vaccinated and are thinking about getting the booster shot. So if your first 2 vaccinations are fine, you're not allergic to the vaccines, this is a good reason to go for your booster shot.
Absolutely.
Yeah.
Okay. So I don't think we would be seeing, even with Omicron coming in here in the Philippines, we might see a spike in cases, but I don't think we would see a lot of hospitalizations. Yeah, so I think ECQ will still be,
There will still be ECQ.
It won't be easy.
But Doc, you are on the ground. You've been telling us over the last 2-3 months the number of COVID patients you've seen in the clinic has actually been dropping.
Yeah, dropping. Yeah. It's true. A lot of people are not getting sick nowadays, but of course that's
good
for
news.
the old variants, the Delta, the Alpha, and the Beta variant. So people are seldomly get sick nowadays. But of course, with the Omicron, expect that people will still get sick, but don't expect them to be hospitalized.
Wow, that's absolutely a great news to start for 2022. So don't be afraid. Go out there and live your life, right? Live your life. 2 years is enough that we surrender to COVID-19.
Yeah. Also, great news for our medical frontliners out there.
Yeah, hallelujah.
Okay.
Praise God.
Yeah. So here's another thing, no. What if you have a hybrid immunity? So meaning you previously got an infection of COVID-19 and then you also got vaccinated.
Wow.
Now,
double.
if this is who you are, then your immunity against Omicron is higher.
Wow.
Way higher. So take a look at these 3 graphs, F, G, and H. Okay, so first take a look at F and G. So what you are seeing are the antibody levels after a previous COVID-19 infection. Okay? So your antibodies will still work well against the Alpha, the Beta, and the Delta variants. But it will not work as well for the Omicron variant. Okay? So if you are someone who had a previous infection and got vaccinated, then take a look at
the super immune.
H. Okay? At the graph H. Okay? So what you see here, the Omicron bar, right? You will have a much stronger antibody levels or much stronger immunity against Omicron. Okay?
It says they're super immune. Wow.
Yeah, super immune. Actually, this data came from the UK. Okay, so this one was actually released a month ago. So this is what they found out. So it's really very important that you get your vaccine, you get vaccinated.
And I think, Doc, this is such great news for frontliners because many frontliners were vaccinated,
Yeah.
but also became COVID positive.
COVID positive, yeah, because we were actually exposed. practically,
But
you
this
know.
tells us that the more exposed you are to the virus, the stronger your resistance for future variants as
Yeah,
well.
correct.
I think that's such great news. It really makes me I wanted to say that it makes me want to rush out and become COVID positive, but no, that's not a good thing. But it really makes it so that those of us who were COVID positive, it's not a bad thing. In fact, you are probably more protected than anyone else, especially if you are also vaccinated. So get both, right? I mean, get your vaccination. Get your vaccination.
Yeah, now here's the question. Doc, what if I am not eligible for vaccination? Then that would be a problem. Not just, in terms of health, but also, it's really inconvenient because a lot of policies that are coming out today, they are really pushing people to get vaccinated. They are making it very inconvenient for those who are unvaccinated. But of course, we cannot turn a blind eye to those who are not because they're simply not eligible to be.
There
to
might
be,
be some
to get
medical
vaccinated.
reasons
Yeah.
why you can't.
Okay, so how is your approach going to be from here on out? So it's very important that you maintain the robustness of your immune system. Okay, your immune system should be smart. Okay, so number one, you have to know what is your enemy. Okay, so this is COVID. How does COVID kill? It kills by inflammation and it increases your risk of hospitalization and death if you have a lot of comorbid conditions like your hypertension, your diabetes, if your weight is high, if you have cancer, if you are ongoing chemotherapy, radiation therapy, if you are undergoing steroid use, long-term steroid use, okay, for that matter, no? So these cases, then it's very important that you have to reverse these illnesses. Okay? So how do you reverse these illnesses? Number one, you change your lifestyle because these are lifestyle-related illnesses. If it's lifestyle-related, it can be changed.
With your lifestyle.
Yeah, with your lifestyle. So you are entirely in control of your illness.
Wow,
Alright?
that's good news. In control.
Yeah.
You start 2022 in control.
In control, yes. But of course, it is easier said than done. Okay? Because number one, what kind of diet you should be eating? You should be eating a plant-based diet, okay? And a whole food plant-based diet at that. Okay, number two is you have to exercise. I know a lot of people don't eat vegetables, a lot of people don't exercise. Okay, fine. Okay, here's a solution for you. But always remember, those two are your strongest weapon against COVID-19. Okay, and against these illnesses. COVID-19 may be here with us
for a long time.
Yeah, for a very, very long time. But please realize this, okay? Diabetes, cancer, and heart disease have killed more people than COVID combined, okay? Heart disease has been our number one killer, not just in the world, but also here in the Philippines for decades already.
Wow, decades already.
Yeah, and cancer has been in the top 5, no, for the longest time. Also diabetes. Okay, so you have to realize this. If you don't die from COVID, you die from the food that you're eating. Okay. Alright, so what is the solution to this? Yeah, it's very difficult to change lifestyle, Doc. Okay, here. You can take SimplyNature PPARs. Okay, so take them. This will help you, make your insulin more sensitive, make your insulin function better. It can decrease your cholesterol levels. If you have cancer, please go for a consultation because we can help you, especially when you are undergoing chemotherapy. Because SimplyNature PPARs will help you finish your chemo. Okay? So, if you want to know more about these different protocols for your cases, please go for a consultation because we tailor our protocol to your case. Okay? So, that's basically it.
Thank you, Doc. And again, the Q&A is the most exciting part of the program, so we're trying to keep this short so that we can answer as many questions as possible. Doc, you are a lifestyle medicine specialist. But you really believe in Simply Nature PPARs. Why is that so? Just so that our audience understands.
Well, one of the key things or key principles that we as lifestyle medicine doctors, how we prescribe these stuff to patients. Number one is it should be in compliance with what we practice. So we prescribe food, okay? And Simply Nature PPARs, it is literally food. I mean, it's made out of a special strain of microalgae. It's a microalgae itself, just cleaned up and formed into tablet form. So it's as natural as you can get. Okay, and another thing, what's so amazing about being it natural is that you get the whole spectrum of antioxidants, whole spectrum of phytonutrients, whole spectrum of the nutrients that work well together. That's why it's really amazing. Once we take it, we see dramatic results, especially for those.
So you've seen a lot of dramatic results with your patients.
Yeah. Youngest one is a few weeks old.
A few weeks
old, and to the most extreme, 80 plus years old. Yeah. Okay. So both are cancer patients. The baby.
Even the baby was a cancer patient.
Yeah.
Tumor. Wow.
It's a tumor in the liver, and another one is a 80 plus year old breast cancer patient. Okay. So both actually responded well. Of course, the 80 years old patient actually, she passed away, but of course she's already 80 years old. But in the last few moments of her life, I believe the quality of life is really good. Yeah. The family even
the family actually called to thank us, right? Wow.
Yeah. So it's really amazing, what this product can do and what Whole Foods can do for you. So that's mainly the reason why I'm a super believer of this.
And that's why the strategy is all there. It works, and that's what's important. So, Doc, without further ado, let's go into our Q&A.